Hello and welcome to the Business Spotlight interview series. I'm your host, Barrett Macdonald. I'm happily joined today by Chere Chapman, co-founder and CEO of Ardea Outcomes. Chere, thank you so much for joining us today. Would you like to kick things off a little bit about who you are and what your company is?
Yeah, thanks for having me. It's a real pleasure to be with you today. I'm excited to have this conversation. Chere Chapman. I'm co-founder and CEO of Ardea Outcomes. My co-founder's name is Dr. Kenneth Rockwood. He's a world-renowned professor from Dalhousie University, who also has a thriving geriatrics practice, dementia practice, and is, I think, globally best known for his work in frailty. But he originally founded the company, and he was my honors supervisor a very, very long time ago. He convinced me to go into health research and epidemiology, which I did. And fast forward, a master's degree and an MBA and 20 plus years in Europe and Asia. I ended up back in Atlantic Canada, and he and I joined forces again and revamped the little company that he'd started and turned it into Ardea Outcomes. And here we are. We are a professional services company mostly. We're a contract research organization. That's what it's called. And we do bits and pieces of clinical trials research for big multinational pharmaceutical companies and other contract research organizations. And our specialty is capturing the patient experience. We work in clinical trials to try to help patients set their goals for treatment and then capture whether or not they're actually obtaining or attaining these goals, which doesn't sound super exciting or novel, but it really is cutting edge work that we do.
I'd imagine it's incredibly important because, when it comes to business and everything, if you don't know where you're going and what your goals are, you don't know what steps to take to get there. So it sounds like you're doing a lot of that in a good way.
Yeah, it's really a purposeful approach. It really puts the patient at the center of research. So they aren't just kind of along for the ride in a really complex clinical trial setting. You obviously have to do all the laboratory work with patients, and you have to ask them all the survey questions and other things you normally would to get a full picture of their health. But it's shocking that no one actually says, how would you define success? How would you know that this drug is working? What would you be able to do that you can't do now if this drug was actually allowing you to live the life you want to lead? And when you do get into that conversation, you have all sorts of nuanced conversations about people's goals and their aspirations and their quality of life. And those things, of course, don't always match what the pharmaceutical company's interests are, what the clinician or other doctors' interests are. And it really puts the patient right in the very middle, which is what pharma is really trying to do now. So it's great.
That's awesome. That's fantastic. So, what would you say since you took over the helm as a co-founder and owner, to are some of the common misconceptions about running a business, and what do you do to combat them?
Oh yeah, I don't even know if that's since I took over. I think that's just in general. I have had, even before I joined Ardea, I had my own other company. And I think one of them is just that business seems really accessible to people. So everybody can have an opinion, you know. If I tell you that I'm building a rocket company, you're not going to argue with me about how I do it. But if I tell you that I want to sell you a professional service, everyone's bought a professional service before. Everyone's been at the receiving end as well. Some people have actually, given their own or whatever it is. So everybody has ideas about how easy it is to run a business that they think they can understand. I think you have a restaurant, right? I think even that, like from the outside in, if I ran a restaurant, do you know how hard it is to run a restaurant? So there's a lot of misconceptions. I think that business is just common sense. It's a lot more complicated than that. I think of a business kind of like a really complex system, and you might get one part of the system running perfectly and smoothly, but it really doesn't matter unless it's all running perfectly and smoothly. And in my experience, that's the hard part. You can get pockets that are just humming along, but to actually have the whole thing moving in a beautiful way is really hard.
Yeah, trying to keep all the balls juggling in the air at the same frequency is always an interesting task. And
Yeah.
I mean, there's always curveballs, so you just got to be nimble and just roll with it sometimes, which is a lot of fun. So you now have some staff and everybody on board. What qualities do you look for when you're onboarding your staff, and how do you foster that positive work environment?
Yeah, I think probably the one thing I'm most proud of, and I think some of my colleagues who've worked hard on it with me would agree, um, we're pretty proud of the culture we've created. So it's a small organization, and I know there's a lot of cliches around culture, but in our case, we really have sort of walked the talk, and we really, really believe that the culture is the foundation of everything. So I do hire for cultural fit before anything else. It's a deal breaker if we're not going to have a good cultural fit. And we have spent a lot of time developing our values as an organization, and we don't just pay lip service to them. So once we really established what our values are, we've actually translated that down to ways we behave with each other and how that actually works. So if I'm actually exhibiting our company value of excellence or our company value of collaboration. What does that actually mean? Everybody knows what the word excellence means, but what does that mean to Ardea Outcomes? And then what behaviors am I going to exhibit in my work with my teammates or with clients or with other vendors or with people that I interact with that would let them know that I'm actually living this value? So that cultural piece for the people we hire is key. And then the second thing is we're in a very highly sophisticated, highly regulated by the FDA and the EMA and all these other groups industry. And so we do have to hire people with very high level of sophistication and technical skill. And it's a quality related thing. It's not just because it helps us do better. We also have to prove that the people we have working in our group in any particular area are uniquely qualified to be doing that work. So it's not that easy to fly by the seat of your pants. So you need to really make sure you've got that marriage of people who've got the right skill, but also got the right kind of culture is almost like a mindset, right? You need to have both at the same time. So I'd say those are the two key things we hire for. The third thing, which is rare in science, I think, is that people, it's part of the culture, people need to understand what an entrepreneurial environment is. And I know we hire across the country, so we have people from St. John's to Vancouver, but in Atlantic Canada, there haven't been a huge amount of companies like ours in an industry area in healthcare. So a lot of the people we're hiring are coming fresh out of academia or out of government jobs. It's just a different world working in business, and working in a small business that's in growth mode is particularly chaotic. And having that flexibility and that openness to being pulled around and shifting to where the business needs are, that's another thing that's part of that sort of cultural focus when we're hiring.
Absolutely. So, what would you say have been your biggest learnings as you're onboarding staff and being an employer?
Yeah, well, sometimes it's hard to tell. And I also think too, people don't know what they don't know. So it is, it's a learning process for them and for us if they've just never worked in this space. So intellectually, you might be able to say, oh, sure, I'm a flexible person, or oh, sure, I'm doing this. So I think being open to understanding that you can't have everybody have everything on the first day. And as long as you have that a baseline cultural fit and baseline technical fit, we stick with people. We work hard to make sure that they've got what it takes to succeed in our organization. So I think I might have been naive about how long that sometimes takes. It may take some people, it's not a 1 month onboarding process in our company. There's a long onboarding process, and people need the chance to really settle in and learn how to thrive in our industry, which most people haven't worked in before, but also in our organization in particular.
So, what do you really attribute your company's growth to?
I think the growth at the moment is finally, I think we've been working hard to educate the market and grow a new market. And a lot of the growth we're seeing is coming from the results of that. So Dr. Rockwood first had this pioneering idea to use this method for goal setting in clinical trials called goal attainment scaling back in the 90s. And it's taken a really long time to get people excited about it. So the early innovators and the early adopters, our research partners, a lot of big pharma companies have been working along with us, but they've always been skeptical and concerned about how the regulators are going to perceive this type of work. So you can't just throw this into a clinical trial. You need to know that the FDA is going to like it too. So we worked really hard for decades, and we finally got, I wouldn't say they endorsed it, but the FDA actually kind of gave a nod to the work that we do. So they have a whole, I call it the Bible of patient-centered research. They have a whole guidance series of patient-focused drug development and how you should do it. And there are 4 books. And in the last book, which is a draft guidance on this particular part of patient-focused drug development, they actually said, you should think about goal attainment scaling. It's a great method. And there's only one company in the world that specializes in goal attainment scaling, and it's been a pioneer in bringing it to clinical development and clinical research, and that's us. So since that time, you can imagine it's been a pretty exciting time for us to finally have them endorse that and get people, again, maybe not officially endorse, but give a bit of a nod to it. So that's been, I think at the moment, that's one of the things fueling our growth for sure.
Absolutely. So you're pretty busy. Everybody's pretty busy. What are some of the tactics you use to balance your personal life with the demands of running such a growing business?
Yeah, I don't know. It's very blurry lines. So I'm not one of those boundaried people who never works on Tuesday evening. I also really value my time with my family. I have a big family, so I have 4 kids. I've been married to the same guy who I met even before I met Dr. Rockwood back in undergrad, and we do try to spend a ton of time together. So I don't know. I just try to balance the two as best I can by not letting either one of them take over. I think they're pretty understanding people, but I think this is part of entrepreneurship too. I don't think it suits everyone. I like the fluidity of maybe on a Tuesday afternoon, I'm going to leave early and pick up my kid and take them to the dentist and then go to a soccer match. And I don't have worry about the fact that on Tuesday at night at 9 o'clock, I might be online for a couple hours. It suits my personality. I
Right.
love flipping back and forth. So I think that's one of the main ways is I don't worry about these arbitrary distinctions between work and family. But yeah, you do need to keep it in check, that's for sure. You don't want to burn out. And I do have that, I have to be honest, I have that quintessential working parent thing. I think it's been really common amongst working mothers, and I think it's the same with other working parents now too. It's certainly creeping up where you sometimes feel you're not doing anything perfectly, right? You sometimes feel like you're not the best mom today, or you're not the best CEO. You just kind of do your best for both. So it works very well that my co-founder, Ken, and I both believe very strongly in the better done than perfect motto. So we're moving forward incrementally, but we have no illusions that we're going to have the perfect business tomorrow. And I kind of feel like that at home as well. Some days the house is a complete mess, and some days it's better than others.
Fantastic analogy. So would you say you have to be very purposeful with your calendar and trying to schedule as diligently as possible?
Oh, my calendar is like some kind of military operation, and I don't understand how other people do it. I'm constantly having people say, like, you don't have anyone to manage that. That would drive me crazy. I micromanage my own calendar, and no one can touch it, and nothing gets in there unless I personally put it in. And that works really well for me. And you can imagine our family's Google Calendar situation. My husband's an even more kind of well, he's a very sort of elite business guy, so he's got it all figured out as well. It's like some kind of military operation for sure.
That's fantastic, Sherry. Good analogy for sure. So if you had to start all over again in business, and start from square one, what do you think you'd do differently the next time around?
I think I saw this question somewhere. It made me laugh so hard. Like, isn't that the whole entrepreneurial joke? Like, if you knew then what you know now, most people I know who are in entrepreneurship would go, "Oh, no way. There's no way." If you were, and I think that's something that entrepreneurs have. You either have some type of arrogance because you think you can do it, even though you have no idea what you're setting out to do at the beginning, or it kind of bleeds into an extreme optimism. I like to think I'm a very cup half full person, super optimistic. Maybe it's to the point of delusion. I don't know. But if I knew just how hard it was, or exactly the level of sophistication I needed to operate as a tiny company in a highly regulated, complex research environment where, there's a million laws and rules and whatever else, I'm not sure I would have had that same optimism back then that, oh, sure, I can do it. Because that's what an entrepreneur says every day. I can do it. I can't be that. I'll figure it out. I'll figure it out.
Yeah.
So I don't know. I feel like that's a trick question. I don't
Nope,
know what
it's
I'd
not
do
a.
differently. I might not do it at all.
Yeah, I mean, the answers are varied. Some people are like nothing. Some people are like, I'd hire two more people a whole lot faster.
Oh yeah,
Um,
that kind of stuff is
and-
easy. Like for me, it's more like an existential thing.
yeah.
You know, I think it took me a long time to work together with Ken to figure out that we wanted to really go into business together and co-own it. So I first got involved in Ardea back when it was named DGI Clinical in 2016. And we didn't end up buying out all the other investors and co-founding Ardea Outcomes until 2021. Now, part of that was the pandemic and stuff got in the way, but yeah, that took too long, way too long. We could have figured this out sooner. We're having a great time. We're great business partners. We should have figured that out sooner, I think.
It's fantastic. Well, the whole world had a pause in there in the middle. So I think that when everybody can give themselves the same excuse for grace, it's a big thing for sure.
Yeah.
And I guess that your business would have been booming a little bit after the pandemic with all the trials. It's a good way of doing it. It brought a lot of that to the forefront.
Yeah, I think so. We did well to survive the pandemic when clinical trials were paused. But in addition to that, we had all the same other dramas that everybody else had. The main way we actually market our work is to just do really, really good science and go to all those international conferences and present our work orally and with posters and whatever else, and also to publish in peer-reviewed journals. And that was all kind of paused for a couple of years. So that was tricky. But yeah, we did emerge from the pandemic really strong with the exact same team intact, which I would not waver on. No firing, nothing, no furloughing, nothing. And so we were really proud about that. And it served us really well. So we could pick up exactly where we left off when the pandemic ended.
Well, that's fantastic. So, Sheriff, you could leave us on a parting piece of wisdom about someone who might be watching this series at home, thinking about jumping on their dream and an entrepreneurial journey. What would be that one solid piece of advice you'd have to share?
Oh gosh. So I don't know. I feel like the entrepreneurial journey is kind of like life. So you need to think about what it is you're truly passionate about, and also where it is you think you can make a unique contribution that's different and better than the other contributions other people in that space might be able to make. So where can you truly be a leader in this field? And then you need to figure out whether anybody wants to pay you for it. And once you've got those three things, you've got a business, but you need the passion. So you need something that you really care about, that you can get behind, that's going to allow you to develop a purpose-led business. And that will sustain you for a really long time when the other two things get tricky.
That's fantastic, Sheriff. Thank you so much for your time today. And to those of you watching at home, I look forward to seeing you in our next episode.
Thank you. Appreciate it.